In the September 23rd issue of JACC, long-term outcomes of PCI versus CABG in insulin and non-insulin dependent diabetic patients. It's results from the FREEDOM trial. And I'm with the second author of the paper, Michael E. Farkouh, MD, who is at the Peter Munk Cardiac Centre, and where you're the Director of Heart and Stroke at the Lewar Centre, correct? And this is the University of Toronto. First things first, remind us, before we start talking about this new paper in JACC, remind us about the FREEDOM trial.
Well, the FREEDOM trial really evolved on the heels of many other studies that were conducted over the last 20 years. And the Berry study 20 years ago showed that in diabetic patients, there was a tendency and a trend for them to benefit more from bypass than from PCI. But of course, that was before we had bare metal stents, we had any type of stenting, and it was before we had a lot of the potent antithrombotic therapies. So that question of the diabetic subpopulation has been in play now for about 20 years, and FREEDOM tackled it head on. And this was a large study of 1,900 patients with multivessel coronary disease and diabetes, conducted at over 100 hospitals worldwide, where there was expertise in PCI and in CABG. And the trial essentially showed that there was a life-saving and reduction in mortality and a life-saving reduction in MI in patients undergoing CABG by 5 years, with a difference of about 8%, 27% versus 19% in favor of CABG. So more events in the PCI arm. However, the caveat was that there were more strokes in the patients undergoing bypass. So it really was a finding that has allowed us to now challenge how we think about this. It's not every patient one size fits all, but rather patients now have to be educated about bypass, and they need to be approached about bypass when they have diabetes and multivessel disease. But we have to always also educate them about the stroke risk, which is small, but significant enough that we're concerned that we need to continue to explore this.
So now, this new paper in the September 23rd issue of JACC, it's a subgroup analysis. What was your objective first for this study?
Well, the objective of this study, and this really came, our first author, George Dangas, really was the one who really pushed for this analysis. We have a number of analyses that we can do in FREEDOM, but this is one subpopulation of diabetics which has always been very interesting to us, those that are treated with insulin. For some of us, we've always felt that those patients are those that are higher risk because they've had diabetes longer and they have more complications. But others in the interventional community have felt that maybe this is a group of patients that is at higher risk for more aggressive coronary disease, independent of how long they've had diabetes, and whether insulin itself has some effect on the heart that we wanted to explore. So this subpopulation of, particularly in those undergoing PCI, has always been a very pressing one, and one that was challenged and proposed for FREEDOM.
So now we know the FREEDOM results. What did you find in this sub-analysis?
Well, essentially what we found were two important findings. The first was that we confirmed that patients who are treated with insulin have a higher risk than those that are not. And even when we adjust, it looks like there's a greater risk of complications for those treated on insulin. It's in the range of a hazard ratio of about 1.6, which is pretty robust. This we don't believe was a new finding. But the important finding was that for the comparison of PCI to bypass, that same trend that we saw in the overall study was maintained whether or not you were on insulin or not. This was a very important finding because, of course, this would have been something that could have changed the landscape in another direction, where you'd have one population treated with one therapy and the other population perhaps treated with the usual care. So those were the two main findings of the study.
What's the take home at this point in terms of what you would do or recommend?
What we believe is that if you're on insulin-treated diabetic or not, you should still be considered for bypass surgery if you're a FREEDOM-like patient. I want to make the important observation, though.
Define that a little more in terms of the FREEDOM population.
The FREEDOM population are those with multivessel disease that have aggressive disease. So on the spectrum of diabetes, these are really the highest risk people. that we would consider for PCI or bypass. There are some patients who are extremely high risk who no interventionalist would go after. But when you look at the patients that would be considered for PCI, these are the highest risk patients. We're not talking about single vessel disease or very focal disease. We're talking really about those patients with very aggressive multivessel disease. So that's very important to point out. And I believe that there's a message here that perhaps those treated with insulin may suffer some untoward effects of insulin itself. Is it the way we treat diabetes that's affecting coronary disease? And we really need to examine that. So we're really now going to go back and evaluate the different therapies we give patients and how early do we start insulin? And is it the duration or is it the types of therapies you receive? So it's going to take us back to the drawing board. I think we're going back there anyways in diabetes because we can't get to the promised land with any of these therapies, and we can't show benefits. So we want to do what's safest for our patients. I think we should think of this as a safety study and moving forward to evaluate insulin in that manner. And the second thing is that we need to reassure all of our colleagues and all of the doctors and the patients who have diabetes and multivessel disease that we think the results of FREEDOM are robust. So that as we look at these important subgroups, we're finding that the true difference has held up.
Well, this is the September 23rd issue of JACC, so please look up the FREEDOM trial and the sub-analysis. And for Cardio Source World News, I'm Executive Editor Rick McGuire.